A patient in progressive care develops sudden shortness of breath and hypotension. Which intervention should the nurse perform first? A. Administer 4 fluids immediately. B. Call the rapid response team. C. Place the patient in high Fowler's position and assess airway. D. Obtain a chest X-ray. Answer, C. Airway and breathing always take priority in acute events. Placing the patient in high Fowler's position helps improve oxygenation while quickly assessing respiratory status before further interventions. Which electrolyte imbalance is most likely to cause peak T waves on the ECG? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hypermagnesemia. Answer, B. Hyperkalemia increases myocardial excitability, often resulting in peaked T waves on ECG. Early recognition is crucial to prevent life-threatening arrhythmias in progressive care patients. A patient with sepsis is receiving norepinephrine infusion. Which assessment finding requires immediate action? A. Blood pressure 120/80 mmHg. B. Extremities cool and mottled. C. Heart rate 88 bpm. D. Urine output 30 ml per hour. Answer, B. Cool, mottled extremities indicate poor perfusion despite vasopressor therapy. The nurse should notify the provider and assess for signs of worsening shock to prevent organ failure. A post-MI patient develops sudden pulmonary edema. What is the priority nursing action? A. Administer 4 diuretic and monitor lung sounds. B. Position the patient supine and apply oxygen. C. Encourage coughing and deep breathing. D. Prepare the patient for intubation immediately. Answer, A. Pulmonary edema requires prompt diuretic therapy to reduce fluid overload and improve oxygenation. Positioning upright and administering oxygen support respiration while monitoring lung sounds guides further interventions. Which arterial blood gas result indicates uncompensated metabolic acidosis? A. pH 7.50, HCO3, 32 milliequivalent/L, PaCO 2 50 mm of mercury. B. pH 7.28, HCO3, 18 milliequivalent/L, PaCO 2 40 mm of mercury. C. pH 7.38, HCO3, 26 milliequivalent/L, PaCO 2 45 mm of mercury. D. pH 7.45, HCO3, 28 milliequivalent/L, PaCO 2 36 mm of mercury. Answer, B. Low pH with low HCO3 and normal PaCO 2 indicates uncompensated metabolic acidosis. Prompt recognition allows nurses to intervene for underlying causes like renal failure or sepsis. A patient with atrial fibrillation is prescribed amiodarone. Which assessment is most important before administration? A. Blood pressure and heart rate. B. Serum glucose. C. Urine output. D. Peripheral pulses only. Answer, A. Amiodarone can cause bradycardia and hypotension. Monitoring vital signs before administration ensures patient safety and guides appropriate dosing adjustments. A patient with heart failure is on furosemide. Which lab result requires immediate attention? A. Sodium 140 milliequivalent/L. B. Potassium 2.8 milliequivalent/L. C. Chloride 100 milliequivalent/L. D. Magnesium 2.0 milliequivalent/L. Answer, B. Hypokalemia, K plus less than 3.5 milliequivalent/L, increases risk for cardiac arrhythmias, especially in patients with heart failure. The nurse should notify the provider and anticipate potassium replacement. A progressive care patient with COPD is receiving supplemental oxygen. Which finding indicates hypercapnia? A. Restlessness and tachypnea. B. Heart rate 88 bpm. C. Blood pressure 110/70 mmHg. D. Confusion and drowsiness. Answer, D. Confusion and drowsiness in a COPD patient on oxygen may indicate CO2 retention. Nurses must titrate oxygen carefully to avoid worsening hypercapnia. Which assessment finding in a patient with acute pancreatitis signals a potential complication? A. Mild epigastric pain. B. Gray-Turner sign on the flanks. C. Normal bowel sounds. D. Stable vital signs. Answer, B. Gray-Turner sign indicates retroperitoneal hemorrhage, a life-threatening complication of pancreatitis. Immediate recognition allows timely intervention to prevent shock. A patient with a central line develops sudden shortness of breath and hypotension. What is the most likely cause? A. Pneumothorax. B. Hypoglycemia. C. Sepsis. D. Hyperkalemia. Answer, A. Pneumothorax is a known complication of central line insertion, causing acute respiratory distress and hypotension. Rapid assessment and intervention are essential to prevent deterioration. Which nursing action is essential when caring for a patient with a continuous heparin infusion? A. Monitor PTT and signs of bleeding. B. Check blood glucose hourly. C. Assess for oxygen saturation only. D. Encourage ambulation without monitoring. Answer, A. Heparin can cause bleeding and heparin-induced thrombocytopenia. Monitoring PTT and signs of bleeding ensures safe therapy and allows early detection of complications. A patient with acute kidney injury has elevated BUN and creatinine. Which intervention is a priority? A. Administer 4 potassium. B. Administer 4 magnesium. C. Encourage high-protein diet immediately. D. Monitor fluid balance and restrict nephrotoxic medications. Answer, D. Managing fluid status and avoiding nephrotoxic drugs prevents worsening kidney injury. Monitoring labs and urine output guides ongoing treatment. A patient is experiencing symptomatic bradycardia, HR 38 BPM, dizziness. What is the immediate nursing action? A. Start CPR. B. Prepare for atropine administration per protocol. C. Encourage the patient to stand. D. Document and continue monitoring only. Answer, B. Symptomatic bradycardia requires rapid intervention with atropine to increase heart rate. Monitoring and preparation for advanced cardiac life support are critical. Which ventilator alarm indicates that a patient may be disconnected or have a leak? A. High pressure alarm. B. Oxygen saturation alarm. C. Apnea alarm. D. Low pressure alarm. Answer, D. A low pressure alarm signals a circuit disconnection, leak, or patient extubation. Nurses must check connections and patient status immediately to ensure adequate ventilation. Which finding in a post-operative cardiac surgery patient suggests cardiac tamponade? A. Hypertension and bradycardia. B. Hypotension, muffled heart sounds, and jugular vein distension. C. Tachycardia and clear lung sounds. D. Stable vital signs. Answer, B. Beck's triad, hypotension, muffled heart sounds, JVD, indicates cardiac tamponade, a life-threatening complication requiring rapid intervention such as pericardiocentesis. A patient with sepsis is on multiple 4 antibiotics. Which assessment is most important to monitor for nephrotoxicity? A. BUN and creatinine levels. B. Blood pressure only. C. Pulse rate only. D. Temperature. Answer, A. Nephrotoxic antibiotics can cause kidney injury. Monitoring BUN and creatinine allows early detection and adjustment of medications to prevent permanent damage. Which rhythm on an ECG indicates the need for immediate defibrillation? A. Asystole. B. Ventricular fibrillation. C. Atrial fibrillation. D. Sinus tachycardia. Answer, B. Ventricular fibrillation is a pulseless, life-threatening arrhythmia. Immediate defibrillation is essential for patient survival. Asystole requires CPR and medications, not defibrillation. A patient on continuous telemetry develops sudden ST segment elevation. What is the priority action? A. Administer 4 fluids. B. Document only. C. Reposition the patient. D. Notify the provider and prepare for potential reperfusion therapy. Answer, D. ST segment elevation indicates acute myocardial infarction. Rapid notification allows timely reperfusion therapy to minimize myocardial damage. Which lab finding requires urgent intervention in a patient with acute pancreatitis? A. Lipase 60U/L. B. Calcium 6.5 mg per deciliter. C. Sodium 138 milliequivalent/L. D. Potassium 4.2 milliequivalent/L. Answer, B. Severe hypocalcemia can occur in acute pancreatitis and cause tetany or cardiac complications. Prompt recognition and intervention are essential to prevent morbidity. A patient on vasopressin infusion shows increasing MAP and decreased urine output. What is the priority nursing action? A. Increase vasopressin dose. B. Document only. C. Encourage oral fluid intake. D. Monitor for ischemia and notify provider. Answer, D. Vasopressin can cause vasoconstriction leading to ischemia and reduced kidney perfusion. Continuous assessment and provider notification are necessary to avoid organ damage. Which symptom in a patient with pulmonary embolism requires immediate intervention? A. Mild leg swelling. B. Low-grade fever. C. Sudden chest pain and shortness of breath. D. Occasional cough. Answer, C. Sudden chest pain and dyspnea indicate an acute pulmonary embolism. Immediate assessment, oxygen therapy, and rapid provider notification are essential to prevent mortality. Which finding in a patient with acute heart failure requires priority intervention? A. Peripheral edema only. B. Pulmonary crackles and oxygen saturation 85%. C. Mild fatigue. D. Normal vital signs. Answer, B. Pulmonary edema with hypoxia is life-threatening and requires immediate intervention with oxygen, diuretics, and provider notification to stabilize respiratory and cardiac status. A patient with septic shock has lactic acid of 5 millimoles per liter. What is the priority nursing action? A. Document the result. B. Reduce 4 fluids. C. Encourage ambulation. D. Notify the provider and ensure fluid resuscitation is ongoing. Answer, D. Elevated lactate indicates tissue hypoperfusion. Rapid notification and aggressive fluid management are critical to improve perfusion and prevent multi-organ failure. Which assessment finding indicates hypovolemic shock? A. Warm, flushed skin. B. Bradycardia and hypertension. C. Tachycardia, hypotension, and cool clammy skin. D. Normal vital signs. Answer, C. Hypovolemic shock presents with tachycardia, hypotension, and poor peripheral perfusion. Early recognition allows timely fluid resuscitation and prevents progression to organ failure. A patient with acute coronary syndrome develops ventricular tachycardia without a pulse. What is the immediate intervention? A. Administer oxygen only. B. Defibrillate immediately. C. Place patient supine and observe. D. Give oral medications. Answer, B. Pulseless VT is a shockable rhythm. Immediate defibrillation per ACLS guidelines is critical to restore cardiac output and prevent death. Which assessment indicates early hypoxemia in a progressive care patient? A. Confusion and agitation. B. Bradycardia. C. Hypertension. D. Warm, dry skin. Answer: A. Early hypoxemia often manifests as confusion and agitation before vital signs change. Recognizing subtle signs allows timely oxygen therapy and prevents respiratory failure. A patient with ARDS on mechanical ventilation has increasing peak airway pressures. What is the priority nursing action? A. Assess for kinks, secretions, or patient ventilator asynchrony. B. Immediately extubate the patient. C. Reduce PEEP without provider order. D. Document only. Answer: A. High peak pressures may indicate obstruction or asynchrony. Assessment and interventions prevent barotrauma and maintain adequate ventilation. Which finding in a patient receiving 4-potassium requires immediate attention? A. Serum K plus 4.0 milliequivalent/L. B. ECG showing peaked T waves. C. Urine output 50 milliliters per hour. D. Normal bowel sounds. Answer: B. ECG changes like peaked T waves indicate hyperkalemia, which can lead to life-threatening arrhythmias. Prompt intervention is necessary to prevent cardiac arrest. A patient with atrial fibrillation is prescribed warfarin. Which lab test must the nurse monitor closely? A. INR. B. Serum sodium. C. Blood glucose. D. Hemoglobin only. Answer: A. INR monitoring ensures anticoagulation is therapeutic without causing bleeding. Adjustments are based on INR values to maintain safety and efficacy of warfarin therapy. Which intervention is priority for a patient with multi-organ dysfunction syndrome, MODS? A. Monitor vital signs and organ function closely. B. Encourage ambulation only. C. Administer oral fluids only. D. Wait for labs before monitoring. Answer: A. MODS requires vigilant monitoring of vital signs and organ function to detect early deterioration. Prompt interventions improve survival chances and guide multidisciplinary care.